So, welcome. We're in week 9, and now we are starting our HESI review. This week we do have a discussion question, so don't forget about that. And then next week there are some assignments. Don't, overlook them. Again, of course, I'll go over them next week, but and post it for you in your information. If you noticed, I've already posted you weeks 1 through 8, all of the Kahoots. I've also given you 2 HESI 80 some odd question Kahoots to talk to yourself about what could it be. And I've also put on there a PowerPoint. That is something what I went to your Saunders NCLEX book. I went through everything there and I made, brought it up so that I can talk to you about it. So that is probably the best resource for your NCLEX is through that PowerPoint. Students who I put it up last quarter, they said everything on the HESI was in that PowerPoint. What I suggest, go over, look at the PowerPoint. It is 80 some odd slides, yes, but there's a lot of HESI hints. Then there's, of course, the recaps. So it's less of that, but it's a lot of information. Once you go over it, go to the Kahoots, start testing yourself. And it's like redoing NCLEX questions because what are Kahoots? They really are just NCLEX questions, but the way I make them, because they're my words, their concepts. I take words and make sure that I'm covering it in different angles, right? Depends on how you think about things.
Professor, and you put these PowerPoints under announcements,
It's
right?
already there. It's already there under HESI information. It's all the Kahoots and it's that PowerPoint.
Thank you.
You already, and I'm going to post it again because I want to make sure because some students go, I can't find it. Well, I'm going to tell you probably 3 places you can find it. I try to keep you organized. I try to have it in one place instead of you trying to look all over 3 courses, 4 courses. It's just too confusing for you. So I keep you organized by keeping it one place. So that is your announcement.
I think you froze.
Can you hear me now? All of a sudden, everybody went blank. All right. Thank you for staying. Somebody, I don't know who it was, said we lost you, and I sent a message back. So thanks for waiting. All right, let's just go ahead. Let's get this Kahoots done, and we'll be on with our day and our evening. Anybody, of course, wants to meet me about that exam, not a problem. Let me know. Can you all see that? Who wants to win today? You've studied for an exam. It's Friday night. Now we're going to do a review of the whole quarter here. I know it's going to be a hit and a miss, but again, I'm starting to get you into that whole quarter now, learning about growth and development and diagnoses and growth and development. How does it, how do we work with these children that have congenital heart? What do we look for? How do we approach them? What's our nursing care, right? So now we're going to put it all together. I see Claudia's trying, so I'll wait a second for you, and then we'll get on. We wouldn't want to leave you behind. There you go. All right. Whoop, whoop, right? HESI review. It's something I made last quarter year, but it's a good one. A toddler has a Broviac catheter while playing the IV, the tubing disconnects from the catheter. What's the priority action? So you have a central line and the tubing comes apart. What do you need to do? Like now? So Broviacs are central lines into the subclavian vein, and it can, if you do not clamp it, it's going to start bleeding everywhere. So yes, clamp the catheter, and then we call the doctor, and then we'll figure out how to sterilely clean it, put it back together again, and sometimes they might order a dose of antibiotic because this is a sterile right into the body that has been opening up now to the air. We don't want a child to get, they have a Broviac, they've got something going on. We don't want an infection. So, and it's just had a cleft lip repair surgery. Why should you minimize crying during the post-operative recovery? Remember, it can be one side or two sides. It could be the lip or inside in the palate. So now you've closed up this little opening and now it's closed. So they do these major plastic closures on these children because they want it to be all of the little pink matches up. It's what they call approximate the edges so you don't get a crooked lip. So we don't want to stress it. We don't want extra scar tissue. We want that child to grow up and have beautiful lips. What is the Kahoot spin? Let me look. 356399. Okay. A child has a central line for acute lymphocytic leukemia, and they now have a fever of 103. What intervention is most important? Well, if you have leukemia, you don't have white blood cells, and you're so immunosuppressed, and you can get any sort of infection. But you have a fever now. You have no immune system. So what do we need to do? Now, are we concerned about the fever? Are we concerned about the acute lymphocytic leukemia? Well, yes, there is no immune system. So what we need to do is find out why is there this fever. Take a blood culture. We'll find out if there's any sort of bacteria growing there. And then we can order an antibiotic. We can order antipyretics, but fever control is never a priority. It's why is the fever there? It's the cause of it, not just reacting to, the symptom. A child scheduled for the reduction of an intussusception and has a soft brown stool. What do you do with that? So they're going to surgery. Their intestines sucked into each other like a telescope. And they have to go in and take out that piece of intestines because it's there and it doesn't get unstuck. Well, all of a sudden, you have a stool. That means the intestines is working. So let the doctor know. Very good. Good job there. It's a hard one. A multi. What foods are appropriate to introduce to an infant after they are 6 months old? I mean, we've gone to the point where we've said at 6 months we do it. We offer foods, we offer one at a time, 4 to 7 days in between. We offer rice cereal first because it's less allergenic to everybody, right? So we're going to give pureed fruits, strained vegetables, and rice cereal. Whole milk is for 1-year-old. Fruit juices, they don't recommend them yet. They don't want you just to drink juice. It doesn't have nutrition like pureed fruit would or strained vegetable would. And we know that rice cereal we're going to give it because number one, it's got iron in it. It's iron fortified always. And also, it is least allergenic to them. We don't do sliced beef yet. They don't have teeth. They can't chew. Pureed meat, maybe. A mother says that her child has spina bifida, sneezes, and gets a rash when playing with balloons. What allergy? What are we happening here? So, spina bifida, that myelomeningocele, that glob in the back of the back, where in the spinal column and the meninges are pulled out. Well, we always put them on latex allergy. Many kits come, especially if it's a child who's requiring periodic urinary catheterizations because they have no feeling. We want to make sure that there's never latex from day one because it can go anaphylactic if we leave it there. And if their lips are swelling, they're getting rash, we're close to that point. How can you reduce an infant's risk for otitis media? Oh, what is otitis media? It's an ear infection. We know number one is have nobody ever smoking around the child. That's always part of, the reading. But they also say that we have the child sit up, and especially even after feeds, that it will decrease otitis media because if you have them sitting down, the oral pharynx has eustachian tubes, and the milk, whether it's breast or formula, goes into the ears, and that creates infections. So having them sit up, and that's why. Getting their ears wet, well, that's going to happen. We don't really prevent that. It's now they're getting bottles all the time, every 4 hours or so, right? And adolescence psychosocial development focuses on what? Psychosocials Erickson. What does Erickson say about the adolescent level? I did put the Kahoot from the theorist in your review for HESI, so it's there for you to go over again. We know that Erickson is all about identity, it's all about body image. Who am I? What am I going to be? And then what do I look like? Which is your identity. A 10-year-old with an acute phase of rheumatic fever. What activity is appropriate for the nurse to schedule in the plan of care? You have a child. He's admitted, he's in the hospital, has rheumatic fever. What are you going to do, to occupy the time, right? And they want these children up, out, and moving. The only time that there would be more restriction is if the rheumatic fever had caused heart valve damage. But these children, they have a rash, they have some joint discomfort. These children can be up and out of bed, no problems. And adolescents very depressed. What finding may indicate a risk for suicide? In adolescence, they really are at high risk. They're going through this, figuring out who they are, their body image, and they don't like it a lot then. And things can trigger them. But you will see this adolescent talking about death and dying and what is it like. And when you start hearing that, this adolescent needs to be questioned. Well, why are you asking these questions? Or let them open up about what's happening. Because most children don't talk about death. A child's admitted with depression. What finding is most significant? Confirming depression. So the number one is the sadness. We're going to see irritability, weight loss, weight gain, withdrawing, not talking to friends, isolation, all of those things. But first thing is they're sad. They're just not that happy child that they used to be. Why would you mix an iron supplement with orange juice to deliver the dose? Remember, iron supplements, usually it's liquid through a straw, needs to be given with orange juice on an empty stomach and never with milk, because the citrus of the gastric acid and the orange juice helps it break down and be absorbed. Very good. What would you expect to see when assessing a child with impetigo? And remember, this is a staph infection. It is extremely contagious. We treat it with oral and topical antibiotics. And it's these honey color crusted lesions, and you just watch them spread. It looks like you took an insect bite and you scratched it so much that you opened it up and you created a scab. That's what it looks like, but it is impetigo. And then you'll see it getting more and more and more unless it's treated. A school nurse has a 7-year-old having an asthmatic attack. He can't speak, cyanotic, decreased in shallow breath sounds. What's this nurse's priority? What do you do, number one? So they're cyanotic. Is there an airway? Are they breathing? Right? These decreased shallow sounds. You're going to be ready to keep that airway open somehow, probably to ventilate, administer oxygen, open the airway, administer breaths if it gets to that point. Very good. An infant develops arm leg movement before fine motor finger skills. This is an example on pattern of what type of development? They start arm leg before they start with those little pincer grasps. It's all about proximal distal. So it starts with the legs, and then it starts, the close-up stuff, and then we start, picking around, right? Proximal distal. Our growth is cephalocaudal. Status post cardiac catheterization 2 hours ago via a right femoral artery, which finding indicates arterial obstruction. Remember, I always tell you to worry about looking at the dressing and looking for, bleeding, because they can bleed a lot. They go into the artery and the femoral vein. Sometimes it can clot, right? So what we'll be checking on these children is their dorsalis and their pedis and their posterior tibial pulses. We want to make sure is blood going there. Neurovascular signs, the movement. We see it pale, cool, blanch, we're in trouble. So what do? We're going to call the doctor immediately. Now, would that dressing be with blood? No, there's a clot. So it's clotted off, but it's, impeding the blood flow. A toddler with a spica calf from an MVA wants a toy. What's most appropriate? So safety is always what you worry about. They have that calf from their underneath their arms and down their legs, usually for that hip dysplasia. And this little child, age 1 to 3, wants a toy. What do you think is most appropriate? Well, you don't want anything they can stuff down in there. A toddler are not really into video games, but something soft, something pliable, something that's not going to scratch or hurt them. And that's why it's a soft hand puppet. An infant with tetralogy of Fallot suddenly goes cyanotic and hyperypnic. Priority action. How do you stop a tet spell, a blue spell? Remember, the right pulmonary artery, the right side of the heart, just doesn't want blood to go into the lungs and they turn blue. So we do a knee chest, changes the pressure, pops open that pulmonary artery, blood goes to the lungs, and everything is lovely. These are scary when they happen to you. Happened once to me. A child with DKA has Kussmaul respirations. This is a compensatory mechanism for what acid-base alteration? So in DKA, the body's pH goes down, they spill ketones, and their whole body becomes metabolic acidosis, right? Well, the lungs say, what can I do to help? So they do the opposite. They're going to do that respiratory alkalosis. So they are trying to take care of that metabolic acidosis by their own way and making it respiratory alkalosis. So it's always the opposite what the body wants to do. The body tries hard to help itself. A child's admitted with persistent vomiting and an NG tube is inserted. What findings should be reported to the healthcare provider? And that's the potassium. That's the big thing with it. Everything else is okay, but a low potassium, you could have problems with cardiac dysrhythmias, right? We don't want that. Which food are appropriate for a child with celiac disease? Gluten, right? This is a gluten problem. They have intolerance. They can't eat certain things. Wheat, rye, barley, oats. But they can have rice, right? So any toast, crackers, bread, no. Cream corn is a vegetable. Dairy, fruits, vegetables, they're fine. Chocolate is fine. They just can't have the wheat, rye, barley, oats. Thank goodness for rice flours today, which actually tastes pretty good. Mom hides a toy under an infant's blanket, and the infant goes looking for that toy. What is that called? They know it's still there, even though they can't see it. and that is called object permanence. Even though the toy's not there, the infant, and this starts in an infant less than 1 year old, they know that their toy was there. Let me go searching for it. That's part of tummy time. You hide it and let them try to crawl and get there. While measuring head circumference of a 3-month-old infant, the nurse notices an increase of 5 inches. What does she do next? What could be happening where a head circumference is increasing, whichever amount? Well, you're going to check that fontanelle. Probably it's hydrocephalus, right? Something's occupying space and making that head bulge. So look at that fontanelle. That fontanelle, you have it for the first year of life. Look at it, use it as an assessment tool because it will be firm and it will be bulging. This child might also have a vomiting and, crying because their head hurts. A 3-month-old with GERD has lost weight from the last appointment. How can you increase calories and decrease vomiting? That's the key to do. Because even though they're eating, if they have all this spit up, they're not getting any of the calories, right? So what we want to do with GERD is we want the food to sit and stay down. So we make it thicker. And we do it with a little bit of rice cereal. They say 5 mLs of cereal or a teaspoon per ounce of a fluid, whether it's breast milk or if it's formula, and it holds it down. How do you know if it worked? They're not vomiting as much, they're gaining weight. What is the most important reason for implementing discipline for infants and toddlers? Do infants and toddlers need to be having discipline? If you know what's right, what is wrong, what you should do and what you shouldn't, it gives you that sense of, I know my boundaries. And actually, it gives them that sense of security. And that's why it's not about social skills or learning authority. It's none of it. What it does is, I know I can do this, I can't do that. And it gives them that sense of, all right, I know what I need to do. Doesn't mean they always do it, but they do know. A newborn is noticed to have a hypospadias. The parents want to know when this should be repaired. This is when the urine doesn't come out the end of the penis in a male. The whole of the urethra is down here somewhere. Could be up towards the top or down towards the bottom. So they're not urinating normally. It works. Urine comes. But they want to do it before they're potty trained. Now, as I said, it works. There's not a problem with it, but we want them to get as big as they can before the surgery. And then they want to do it before they're potty trained. So they're not called attention to it. They usually say before the first year of life, but it depends on, the child's condition too. What would be the drink of choice for a child with sickle cell disease on a hot summer day? Remember, sickle cell children, we need to keep hydrated because we want their vessels to keep big so those cells don't get stuck anywhere. So if they're out enjoying the sun, they need something that's going to keep them hydrated. Now, tea is going to make you dehydrated more. It's a natural diuretic. You don't want milkshake that doesn't work or Diet Coke that's got chemicals. Plain old lemonade is very good for them. But you see why not iced tea? They're going to diurese. You're doing opposite what you want. A multi. An infant with diarrhea is lethargic. What assessment findings would be consistent with dehydration in a children? And dehydration in a child or an adult, they're all about the same. There are differences with some infants. So you're going to have elevated heart rate, decreased blood pressure, prolonged capillary refill. In children, infants, crying with no tears, we're going to see a depressed fontanelle with them, right? Even their eyes get sunken into their head. And then, of course, decreased urine output, smaller diapers, and they're not urinating. So those concepts you'll always see. Adult, children, dehydration, what do you see? Chinese child just finished treatment for pneumonia. And you notice these round bruise-like blemishes on the chest. What is that? What do you do about it? Nursing action. Always remember there's many cultures that believe in a lot of different things. If I see things I don't know, I'm going to ask, what are these things? How did the child get them? And they're going to tell you it's what we do to pull out the sickness out of the child. They do what we call cupping. There's so many cultures. You're not expected to know what they all are, but you're expected to say, I don't understand. Would you tell me? And that parent, that child, they'll be more than willing to talk to you about it. And they'll respect you more because you asked about it. You just did not ignore it. What statement indicates understanding of the mode of transmission of Lyme disease? What is Lyme disease? I've seen Lyme disease very tricky in how to diagnose it. And we know it's all about a tick, a little bug, right? So where do you get ticks? Where's the most big possibility? If you're out in fields and there's a lot of grass and brush and you have to go through it, those ticks are in there. So wearing long sleeve pants and stuff, that's going to help decrease the possibility of ticks getting into it. And that was the concept about that. How can you prevent diaper rash on a 4-month-old? So using a barrier cream, the thing is some parents don't understand. You don't have to just get it all off in between diaper changes. They think, especially things like Balmex, Destidin, you put it on and it's thick and it's there and you think you got to get it all off. No, just take it and wipe it normally. If you need a little bit more, you apply a little bit more. And putting that barrier will protect them from diaper rash. How do you evaluate the effectiveness of thyroid therapy in a 5-month-old? So, thyroid, they're getting therapy. That means they are hypothyroid. What does thyroid hormone do for a child? And how do we measure it? Well, it's about cognition, it's all about growth. Those are the two things with children that are different than adults. So, if we're seeing them able to turn over and coo, we know at 5 months that's normal. So we know cognitively they are where they need to be. If they're not doing the other stuff, that means they are not, don't have the cognitive what they need to do it. So the therapy's not working. So do you see how that question is? A 3-year-old with a congenital heart disease pulse is getting lower over several hours. What else do you need to report immediately? So you have a congenital heart disease child and their heart rate. You see it getting lower and lower and lower. what do you need to check? I mean, yes, you got to call somebody. What else should be checked? And that's when you talk about heart rate, talk about blood pressure. A 3-year-old with 70/40 is low. This child is actually going into shock. Initially, it goes into an elevated heart rate, and then over time, it gets lower. A toddler needs an LP for possible meningitis. What teaching should the nurse provide? Lumbar punctures, a child ages 1 to 3, it is scary. So teaching is difficult. And we know an LP is going to be on the side. I would take children that age and say, I'm going to hug you underneath your knees and your arm, and I'm going to hug you. And the doctor's going to be touching your back. You should not feel any pain, but he's going to touch. And I'm going to hug you so you don't move. And that's usually what that child needs. And then we have a lot of times we have child life will come in with a little pad and they can watch a game or some sort of video and they get through it without a big deal. Again, how did I get to that child and make them trust me? That's that, approaching them on their developmental levels. Parents want to have more children after their son was just diagnosed with Duchenne muscular dystrophy. What do you tell these parents? So, Duchenne muscular dystrophy comes from the mother and it affects the males. So, having you go into genetics, that's what they'll be told. Do you want to take the chance of having another child? And if it's a male, it's going to have Duchenne. You find a child unresponsive and you yell for help. What action should the nurse take next? You walk in a room and they're out. What do you do next? And this is your basic CPR here, isn't it? So you don't know how long they've been out. It says give your 2 breaths to rise, start compressions, and call for help. I mean, in a hospital, you're doing it all at the same time. But again, keep the airway going. 2-year-old children are playing. What type of play would you expect? Toddlers, what type of play do they like? Toddlers, me, mine. I do. Right? They don't share. So, what sort of play is it? And that's parallel. Good job. An adolescent with type 1 diabetes checks his blood sugar before bed and it's 60, and he ate 4 hours earlier. What does he need to do? Now, one of the things I'll tell you about blood sugars being low and what should you do. If you see a blood sugar of 60, you'll never wait 30 more minutes and do it again. If you have a blood sugar that's low, you're not going to give insulin. You're going to give them some sort of carbohydrate. Those were one of the questions on the exam, and I want to make sure you know that. Blood sugar's low, you need to deal with it. They're awake, something by mouth sugar, orange juice, milk, and then later on get them protein. If they are unconscious, that child you're going to give the glucagon, okay? So give them a bit snack and peanut butter, that's that protein that lasts longer. So you gave them a little sugar and protein, which is perfect. A 4-year-old with an NG tube states, I am going to throw up. What should I do? Well, an NG tube is supposed to empty that stomach, right? So what's going on here? And this is not an uncommon thing that I have heard. So if they have an NG tube and they want to throw up, that NG tube's not working. So you need to irrigate it. Check the position is in right place, right? Reposition if you need to. And then after all that, they're throwing up, NG tube, not working, then you would notify a doctor. What food should you restrict from a child with chronic renal failure? That's an interesting question, isn't it? What don't foods don't the kidneys like? Dairies, fats, proteins, carbs. Which one? And the answer is proteins. You need to have a diet that is lower in proteins because the kidneys can't digest the protein. Signs and symptoms of meningitis in an 8-year-old child include and that's Kernick sign, okay? So these are some of those words that we get, but Kernick's is meningitis, okay? A child received an irreversible head injury after struck by a truck. Who should approach the family for organ donation? I think this is one of the hardest things that we see. We get children in the ER and their pupils are fixed, dilated. We know that the outcome is not good. And every person, they are going to have somebody go and ask. And that person is a transplant coordinator. They're the people who know how to talk to the family and how to get it done in a very, sympathetic way. Because we're asking you to give your child and all of the organs to help somebody else. A personal protective equipment for a child diagnosed with SARS would include do you remember when when COVID came out? Nurses were head to toe dressed in everything we could possibly get. And SARS is a very similar type of diagnosis. We're going to protect ourselves completely. What findings would you see with a child with celiac disease? This all has to do with the inability to digest fat. And it's the belly gets big, and then they have the little tiny little buttocks. That is classic celiac disease. Big belly, it's the fat. A 3-month-old infant just had a cleft lip repair. To prevent trauma, the nurse should do what? So you don't want them sucking on a pacifier. I know it's the self-soother, but that sucking can rip open that suture line. So put the child, that infant, in those soft elbow restraints. It holds the arms out so they can't get to their lip. You gotta be careful they don't smush their face into their bed or to the pillow. How do you assess fontanelles on a 4-week-old infant? Well, number one, the child should be calm, not crying, just sitting up. And then we check it. It's sunken, it's dehydrated. If it's elevated, and bulging, we know that there's something going on with fluid. But you have them sitting up and quiet. A 13-year-old girl is evaluated for possible Crohn's disease. The nurse expects to prepare her for which diagnostic study? Crohn's disease. Well, where is Crohn's located? How do you look at that? How do you evaluate the disease? And Crohn's disease is in the GI tract. So we go up with a colonoscopy, we take a piece, look at it, and see how inflamed it is. What complication of Tegretol is prevented by weekly blood tests? We've talked about, some of the drugs and what does it do? Remember PTU, that hyperthyroid one? That's all about the leukopenia and the sore throat. There's some with drug fevers. There's some with bleeds. This one is bone marrow suppression. Has to do with it makes you more, you're not producing the blood cells that you should. What signs and symptoms should the parents of a child with congestive heart failure report to the healthcare provider? When do you know something's going on with a child who has history of congestive heart failure? That first sign. And that, oof, all of a sudden they gain, half a pound overnight. You're like, okay. Then what are you going to do? Listen to the chest. What do the breath sounds sound like? And last question, a multi. What instructions should the nurse reinforce to the parents of a child with application of a cast for fractures of a right ulna bone? What instructions should the nurse reinforce? They just got a cast put on their arm. It's all of the above. Remember, it's all the 5 Ps, right? That's the circulation, you have to keep it up to prevent swelling, wiggle it to prevent that swelling, and Tylenol's that perfect thing for pain. So how do we do? Danny, number 3, number 2. Trish, good job, Trish. Number 1, which Courtney, good job, Courtney. And then we have an AT and a GT. So we are already done with week 9. That's your first HESI review. You got a bunch of other stuff. Next week, I will do the PowerPoint. So we're going to do it together. And then you have those 2 HESI, the big ones, for us to go over that you can do your questions, look at it, test yourself. Now, I put up today about checking your browser. So read the instructions. I've put a link there. You have to do it before you take a HESI, any HESI. So I don't know if your other teachers put it there, but I know that I put it there for you. Make sure it gets tested before you even consider going for a HESI. Any questions? When is the exam grades going to be posted? Tomorrow before noon. Okay.
Can you repeat what you just said about the HESI thing?
There is an announcement that I put up this afternoon. And it talks about what you need to have on your HESI browser in order to take your HESI. Just make sure that you go through it and you know how